a few things too. Number one would be um, when you feel like you're having a headache because you either are not having the caffeine or you just might have one, really, really try at that moment of time the chamomile tea. Chamomile tea has something called apigenin in it, which is a type of flavonoid that really helps with inflammation. So a lot of stuff with headaches is something called neural inflammation. Neural inflammation is inflammation in the brain. Apigenin helps with that. The second thing is that if you feel like you went off on like one meal, don't feel bad about that. Because remember, we're just shooting for about 90% of the time. Okay. If you're 90% of the time focusing on, taking the supplements, eating everything that we had suggested, laid out, you're gonna be just fine. You'll be just fine. Okay. All right, this isn't medical advice. We already know that. All right, so with a woman, so you have about, you're born with around 2 million follicles, right? And then, by puberty, you're left with, 300 to 400,000 follicles. And then, you lose about 1,000 follicles every month through, natural cell death. Okay, so something called, what's up top of my head? Sorry, I can't think of off the top of my head. It's autophagy. It's called autophagy. It's called cell death, autophagy. Okay. But a big thing is that uh, with the stages of where you're at as a female, it matters. Because if you aren't cycling anymore, then you're not producing any hormone pretty much. So that's when hormone supplements or HRT could be very useful. But then if you are supposed to be a cycling female and you're not ovulating or you're having bad periods, heavy periods, missed periods, that's a huge sign that something is off. Okay, so premenopausal cycling woman, a woman in the age range there. Okay, a woman in the age range should still have a regular menstrual cycle. Perimenopausal, typically between 39 and 55. Okay, so a big thing is, first of all, let's talk about how a lot of your hormones are getting made as a female. As a female, majority of your hormones are getting made through your adrenal glands and then your ovaries, obviously. But you always have something called the HPO axis, which is your hypothalamus pituitary ovarian axis. So that's when your hypothalamus and pituitary signal to your ovaries to produce hormone. Those signals are called FSH, follicular stimulating hormone, and LH, luteinizing hormone. But during menopause and during the perimenopausal years, that signal for you to produce hormone gets less and less. So you're not able to make that signal anymore. So this is why it really all starts with the hypothalamus. But if we go and we talk about a cycle, you know, so the cycle's anywhere between 26 to 30 days. So usually it's a rise in estrogen, progesterone, FSH, and LH. So usually during follicular phase, that's when you have your spike in estrogen and also LH and FSH. But then when you go into luteal phase, that's when progesterone is its highest. Many people have a hard time with luteal phase sometimes, and then before ovulation, is because they're not making enough progesterone. They're not getting that adequate progesterone release. And that's a big issue because your progesterone as a female is very anti-inflammatory, anti-anxiety, and those type of things. It also has a big role with your thyroid gland. Right? Oh, So in postmenopause, okay, or premenopausal, it's kind of, going all over the place. But then in postmenopause, you obviously just have flatlined. very low levels of estrogen and progesterone due to no cycles. That HPL axis that we talked about isn't actually happening. So this is when you get those low estrogen symptoms paired with those low progesterone symptoms. The hot flashes, vaginal dryness, pain during sex, low progesterone, headaches, migraines, insomnia. Okay. So those are all signs of low hormone. Okay. This is exactly why I paired myself with a telehealth medical clinic because with them, they're able to prescribe you, different hormone if need be, you know. But luckily, most of the females that I have right now don't need that, which is really good. So, but just knowing that that's there. So we know that a normal regular rise and fall is about 26, 30 days. But then, hormones can spike up and down, causing symptoms. So here's why this is important because women, obviously, women are on more mood altering medications than men, and it's due to their hormone imbalances. Because when you have imbalances in hormones, then you're going to have imbalances in what are called neurotransmitters, like GABA, serotonin. It's a big one. That's why they have SSRIs, selective serotonin reuptake inhibitors. So when you have altercations in these neurotransmitters due to chaotic hormone balance, no wonder why many women feel anxious, depressed a lot of the times. But if they just focus on getting to the root cause of these hormone imbalances and focus on healing their gut as well, because there's a big role there, they inevitably will improve their mental and emotional health. That's everything we do. So is this all making sense? You can just drop a one or something. So with that being said, reviewing the menstrual cycle. So at the end of your period, okay, you have a decline in estrogen, okay, because progesterone is now getting released. And then FSH, follicular stimulating hormone, stimulates the follicles to grow in the ovary. This is why you're most fertile. And um, that's also with women that are looking to get pregnant. That's when you'd want to do that. Um, so we know that. So this is what it looks like normally. So you have a start of the cycle, estrogen gets higher, okay, luteinizing hormone gets higher until ovulation, FSH does a little spike, and then into luteal phase, you have a high progesterone. But you want to test your progesterone, your hormones in luteal phase because you want to see where progesterone is really at. Estrogen's always fine. Also, when you have a lot of PMS or heavy bleeding, that means that you're not detoxifying your estrogen good enough, efficiently. So that's also going to rise high on like a hormone test. You'll have high estradiol, just high estrogen. So, this obviously is irrelevant for you because we're just using Carrie Jones' presentation. But like, when should you test? If you don't have a cycle, so if you really are on birth control, or do you have, severe PMS or PCOS, or you're just obviously very perimenopausal or menopause, you can test whenever. But if you are a cycling female, you don't want to test, days 19, 20, or 21, a typical 28-day cycle, you know. And the big thing is that I really like dry urine for hormones rather than just blood or saliva. And a dried urine test is a like Dutch test because I believe that with like those, you're getting more of an accurate reading um, with like a Dutch test because you're getting a 24-hour reading. Because on a Dutch hormone test, you urinate on a piece of paper, not actually a piece of paper, but something like that. Don't know the direct name right now, but you urinate that four times throughout the day, and then it pretty much grabs that collection of that data and makes a grade. I wouldn't say average, but actually prediction of where your hormones are at. So immune system. So let's get into the specific hormones. So testing FSH. So FSH is a pituitary hormone that stimulates follicle growth and stimulates the chosen one to advance. Okay. This is the best thing to figure out if it's actually PCOS or hypothalamic amenorrhea. So when I'm really looking at like a PCOS case, like you want to really figure out is it actually PCOS or is it actually hypothalamic amenorrhea? You want to test FSH and LH around day 2 to 3 of the cycle and see where FSH and LH is at. Usually, with a woman that really does have PCOS, her LH and FSH is high. But with a woman that's actually just dealing with hypothalamic amenorrhea, their LH and FSH is low because they aren't really having any hormone. That's why they're not ovulating, if that makes sense. And then LH, luteinizing hormone, is a pituitary hormone. Members see this LH and FSH are the ones that signal to your ovaries, the HPL axis. Okay. And then the LH surge then stimulates egg release for ovulation. Okay. But remember, birth control cuts this off. Menopause cuts this off. Okay. Hypogonadism. So that's when the hypothalamus and or pituitary or hypogonadotropic and hypogonadism, that's when the hypothalamus and pituitary are not producing hormones. And that's where a lot of women, know it or not, you don't have a diagnosis, but that's where a lot of you are at. Your hypothalamus, your pituitary gland, because you are so stressed out, there's so much going on, it's not producing any hormone anymore. Okay. Either due to hypothyroidism, prolonged stress, prolactin, endocrine disrupting chemicals, birth control, genetic mutations, those type of things. So, like I said, it all starts with the brain because your brain signals to your ovaries to make hormone. Okay. So that's why one of the first things I focus on is your endocrine system, which is your hypothalamus, pituitary, thyroid, adrenals. That really all helps with pretty much making hormones in your metabolism to be truthful. HPAT axis, hypothalamus, pituitary, adrenal, thyroid axis. If I stimulate that, if I actually support that, then you feel better than ever, right? So we'll go past MHA, AMA, H. So back to what we are saying though, prolactin. When you have high prolactin, that's usually with birth control or you have usually PCOS. That's why you want to check prolactin. And then if you have high prolactin, it suppresses dopamine. So now you don't really have any drive anymore, right? You don't have any good motivation. You don't have you don't feel good. Okay, so that's why prolactin is important. And hypothyroid, so underperforming thyroid can raise prolactin. Prolactin can impair cycles. Okay. So a big thing is that if you're breastfeeding, that's going to affect prolactin. If you have low dopamine, so everything's a negative feedback loop. Meaning if you have low thyroid hormone, then it's going to impair the gut. But if you have poor gut health, it's going to impair the thyroid. Everything's a negative feedback loop, right? Okay, why does female estrogen decrease? Obviously, age. You want estrogen as a female, by the way. We always talk about estrogen dominance, but having low estrogen is not good. You want estrogen. Estrogen is great for cardiovascular health, bone health. Okay. So you want adequate estrogen. It's that it gets too high due to many, many different factors. So you can get anorexia, eating disorders can cause low estrogen, which will cause many issues. Low cholesterol. 'Cause cholesterol is the backbone of hormones. It's kind of like the beginning to hormones because it circles into pregnenolone and then progesterone. Extreme exercise or training, that's just a form of stress. It's going to decrease estrogen. Yeah, underweight is a big one. Hypogonadism, since the ovaries aren't getting that message to create hormones from FSH and LH, or decreased blood to ovaries, breastfeeding, hypothyroidism, PCOS, fertility medications, and hormonal birth control, obviously, can all decrease. Okay, so why do actually, because obviously a lot of women struggle with overproduction of estrogen. And if this will also help you, overproduction of estrogen leaves you with usually PMS, midsection weight gain, stubborn weight gain, feeling bloated all the time, very watery. So why? It's overweight, obese, perimenopause, surges of estrogen, okay, diabetes, PCOS in some cases, estrogen supplements. These are things like soy, steroid medication, poor liver clearance. So estrogen can actually detox out the body. Dysbiosis estrobolome problem. Estrobolome is a topic for a whole nother time. That's pretty much how your estrogen gets out of your body through the small intestine, through stool. And then dysbiosis is a gut bacterial overgrowth. Over aromatization from testosterone. Testosterone and androgens. When you have over aromatization, that means you're converting too much testosterone into estrogen. The number one thing that really does that is poor insulin regulation. It's by balancing your insulin, helping your thyroid, and helping your liver will improve everything. Environmental estrogen, alcohol is a big one, and then ovarian cyst. And then progesterone is a whole other one. So progesterone made in the ovaries from the corpus luteum after ovulation. Okay, there's different ones, alpha pregnadiol and beta pregnadiol. So usually it's low, and those are the symptoms of kind of like the higher estrogen, but mostly like the migraines, the headaches, the insomnias, the bad PMS. And I say majority of us, or not us, not me, I don't say, but for women from, me doing this for a while, I see it being a lot of obviously perimenopause, but low cholesterol because women, for some reason, always want to be vegan. Extreme stress, extreme exercising is a big one. PCOS and then hypothyroidism are the biggest ones that I see why women have low progesterone. Progesterone could increase, but not, I rarely see it. But if you're on HRT, and then if you're on progesterone, supplements such as Vitex or Chaseberry, but I still have never seen someone with too high of progesterone as a female after, a lot of testing, but it's possible. This is how much you really make during, luteal phase and then, or estrogen and mid-luteal phase. So why is estrogen metabolism important? We talk about this a lot, but this is why we do a flush in the beginning, because your liver plays a huge part in neutralizing and excreting hormones out of your body. Okay. So estrogen plays a huge part in doing that. This is why we really like to focus on like the Metapure or the herbal teas or, things like Estrocort or Jumpstart. All these things really help with the liver and getting rid of excess estrogen. Because remember, all this stuff matters for how you want to look and how you want to feel. So this is the legitimate science behind it. So thing is that, this is going to just mix you up. So we're not going to talk about that. But that's essentially, actually, so when when our other your other client or whatever you want, my other client, Claudia, gets her Dutch hormone test, she wants me to explain it on this video and on like a video like this. And that's when I can explain. what this is, because you'll also see what that really does mean for you with how well your estrogen is getting detoxified out of your body. Okay. So the thing is that people like to make an analogy with estrogen. So estrogen gets filled up. It's kind of like getting your bathtub filled out. But how good is the drain, aka how good is your liver at getting rid of the excess estrogen out of your body? Okay. And many things can affect the drainage. Does that make sense? Okay, we drop a one. Does that make sense? So during luteal phase, before luteal phase, at ovulation, your estrogen gets built up, makes that surge. Okay. It's that surge right here, all right, before ovulation, right there. So it has this surge. So that's the bathtub getting filled up. And then the drainage, how well your liver is, and all other factors, is it getting released out of the body. That's what that means. So this is an enzyme called CYP1. So that's how well you're able to have efficiently that drainage. What supports this drainage? Okay. I3C, which is iduronal 3 carbonyl, which is a type of flavonoid nutrient that helps with that inside your body. Also, DIM helps improve that. This is why you want a lot of coniferous veggies in your diet. This is why you might take, estrocord or something like that. Also, the Menopur has this. This is why many women, feel super better on their cycle after they try the Menopur with everything else that we're doing, because it has these nutrients in it that help with the detoxification process of estrogen. Okay. Okay. So with estrogen dominance, you have poor. It's with so remember, if you're estrogen dominant, being having high estrogen is the symptom because there's a reason to why you have high estrogen. And that's because you're bad at this detoxification process of getting excess estrogen out of your body. Your faucet, the drain, is clogged due to environmental things, environmental toxins, smoking, okay? Um, Sluggish liver coming from processed foods, added sugars, too high of insulin. All those things can impair that. So remember, having having high. So first of all, it's the symptom. You have PMS, you have midsection weight gain. Okay, what is the reasoning behind that? Okay, I have high estrogen. Okay, so what's the reasoning behind having high estrogen? I have poor liver detoxification. I'm not, my liver's underperforming for me to get rid of that excess estrogen, so now it's getting built up. Okay, but what's the underlying root cause of that? See how there's like levels to it. So we have to get to that very, very low level. What is it that's the underlying root cause to why you have a sluggish liver, that then why you have high estrogen, and then why you have that symptom? Because symptoms are just the messenger of something that's going on inside the body. So things that also do improve it is magnesium. This is why it's also everyone's mandatory to get the magnesium, also because it helps with over 300 biological processes, and it's no way that you're able to get more magnesium, get enough magnesium in your diet alone. SAMe, trimethylglycine, methionine, and choline, and methyl B vitamins. Now, each individual is different with these. Um, Choline is a really good brain supplement. Methyl B vitamin is also good. But, depending on where you're at, things are different depending. Are we trying to get your thyroid under control? Are we trying to get your Hashimoto's? It all depends. So the big thing though is that I can't really give you these supplements either because you're also going to be dealing with a gut infection. So it's not going to do anything. All right. You could be dealing with, all this is BPA exposure. So if I just give you these, you know, uh, and you're dealing with already a sluggish liver, it's not really going to do anything. So that's why we always work on the gut and the liver before we work on hormones. So this is really what helps um, foods that really do help with the estrogen detoxification process. Leafy greens, that's why there's a shit ton in the diet. NAC and liposomal glutathione also um, in the Metapure. Calcium D-glutarate also in the Metapure, also in Estrogen. Fermented foods, depending on where you're at, foods high in fiber. We really focus on that, but fermented foods we don't in the beginning. Why? Because if you just add more fermentation into the gut, to the small intestine, you're just adding more to the overgrowth that many of you have. You're adding more into the candida. Okay. So what does beta glucuronidase do to estrogen? It is an enzyme in the colon. Okay. It conjugates. Okay. Is your so always remember this no matter what. Your gut plays huge roles in your hormone balance. And if you don't address your gut before you focus on your hormones, you're not going to get better. Okay. Because your hormones are getting made and synthesized in your gut. Okay. So it does that by beta glucuronidase, which is the process of what we were talking about. Your estrogen getting built up and then getting detoxed, but then it conjugates into the small intestine for you to excrete it through stool. So if you aren't having a bowel movement 1 to 2 times a day, then you inevitably are going to have a overabundance of estrogen because you're not getting rid of the excess estrogen. Yep. And then obviously these are the things that affect that. A lot of citrus fruits have calcium D-glutarate, but also the Estrocore and the Jumpstart EC have that as well. So this is very important as a female. Your ovaries make 25% of your testosterone, okay? And your adrenals make 25% of your testosterone. And then adipose tissue makes the rest of the testosterone. 50% of your ovaries make androstenedione, 20% makes DHEA. 100% of your adrenals make DHEAS, which is sulfate. It's really the active form. 80% makes DHEA, just normal. Okay, what decreases testosterone androgens? Just poor nutrient status. So a lot of us have. And poor zinc. Okay, not enough vitamin D, not enough vitamin A. Um, and then obviously a lot of stress issues as well. The hypothalamic pituitary communication coming from stress. But then age, obviously, if you get into perimenopause, okay. And then if you have high testosterone, a lot of that's insulin issues because uh, that increases androgens. Okay. Androgens increase testosterone, PCOS, obviously, low SHBG, supplementation, hyperadrenal output in some cases. And you normally see that when you're looking at a Dutch test and you see a high DHEA, or not even a Dutch test, you can run normal blood work and you'll see high DHEA. And that's how you know you have high testosterone as well. So, causes of higher DHEA, supplementation, obviously, elevated cortisol, uh, PCOS, hyperlactin, alcohol, nicotine, medications, age, HPO are well causes of lower. And I want you to remember everything with hormone balance or hormones is all about balance. So you want to have adequate of everything. Okay. You don't have too much or too little. That's her. So was there any questions kind of like what this was all about? I know this is like a ton of information. I'm also gonna pull up this. So a lot of issues that women face with poor hormone balance is due to poor liver function and insulin issues and high stress. Those are the common things that cause women to have hormonal imbalances. So how can we improve our liver function? This is why we want to have a low toxic living. By living low toxic, you're putting less stress and toxins on your body and then on your liver. Because what happens is if you're wearing, this is why I have you get that Think Dirty app, Skin Clean app, because though if you scan those products and stuff, it tells you, how toxic is it? Because if you put a lot of dye in hair, that's toxic. Sorry, Ashley, but it's, I never even mentioned this. But yeah, and then like lipstick, like all this stuff, for females, makeup, some of it just, is super toxic, and then it leaks through the bloodstream or through the scalp, and then it just crosses the blood-brain barrier and it just causes terrible, terrible responses. So it'll cause high estrogen. So then that high estrogen is going to cause hormonal chaos. It's also going to slow down your liver because now you have so much toxins. It's also going to be high insulin as well. So yeah. So those are some of the big things that cause a lot of issues because that's just kind of how life is now. So that's why I want to focus on those things. Another thing is, same thing. And then with menopause, the big thing with menopause for hormonal imbalances is because there's so much stress. So cortisol, it's your adrenal glands are making too much cortisol rather than other hormones such as progesterone and estrogen. Because remember, your ovaries pretty much are not in use anymore when you're in menopause. So most of your hormones are pretty much getting made in your adrenal glands. But if your adrenal glands are producing too much cortisol hormone, it's not going to produce enough estrogen and progesterone. Also, I'm actually a big proponent for women getting on the right amount of HRT therapy in menopause. I'm really all for that because I believe that women should definitely consider that when they're at that age because your body's just not going to make anymore. Talk about that. Talk about low levels of estrogen. Yeah, so you have high insulin that increases the aromatase and also increases androgens, PCOS recipe. And then with high stress, that's going to lower the HPL axis, which you had talked about earlier, hypothalamus pituitary ovarian axis, and then poor liver function. We also talked about due to, toxins, really, or even poor gut function coming from gut dysbiosis, leaky gut, and different types of even parasites and worms. But the big thing is that like everything that I'm saying that are aggravating your hormone balance, these are all things that we're focusing on. Because by using the antibacterial, antifungal herbs, by supporting your liver, by supporting blood glucose, by lower glycemic foods and things such as those, that all inevitably improves your hormone balance. Do you guys have any questions? No questions. All right then. So the biggest thing to really focus on, coming out of this one right here, this meeting today, is to really focus on supporting your liver by living a lower toxic lifestyle. That's why I have that on the sheet, is to live low toxic lifestyle. The second thing is to really help with stress management, making sure that we're getting enough sleep on a daily basis, making sure that we're not in toxic, environments, such as, people talking just shit, or just people talking about shit that's irrelevant to you, or somebody just talking shit about someone else. That's all not good for you. Um, you know, um, Working out is also good, but not overdoing it. But what I have prescribed for you also really helps with balancing out those stress levels, making it good and bad. Anti-inflammatory diet also helps with stress. Okay. Some of you with the diet that I have, it's a lower FODMAP diet, so it's helping with the overgrowth of bacteria, aka the dysbiosis that you may have that can contribute to your hormone imbalance. So there's a rhyme and a reason kind of for everything that I have for you. But yeah, if there's no questions,